will be our topic in June. Before we proceed to the Q&A, yet another detour, which is to thank SkinPick for allowing us to meet like they do every month. Um, I suppose by now you have some general idea about how the program works since I explain it every time. We will have a promotional webinar next week. So if you want to learn more about the program, you can sign up for that. And it's like a 20-minute webinar where I will explain every component of the program and how it works. Right now, I just wanted to tell you that we recently launched a new program, which is for parents, because we've had lately quite a number of, well, lately, like in the past few years, quite a number of questions and requests from parents of younger children. Our program is not suitable for people who are under the age of 16, let's say. So, but we've had many requests to help people, well, kids who are 7, 8, 9. So we finally decided to create a program for parents in which we will help a parent help their child. So it's like, because kids don't really react well to the form of therapy that we've established, what we actually do is kind of help parents establish a good relationship with their child and then help them heal through this relationship. We apply the same principles that we do with adults, only adjusted obviously for children. So that's something new that we have. And now, without any further ado, your questions. You can also ask other questions if you like. I've been biting nails and skin picking for 63 years. Primary doctor prescribed sertraline 50 milligrams, and it has helped some. I noticed when I am doing manual hard work or yoga that I'm more calm. I have more inner calm and less OCD. Why is this so? Well, yoga, for example, is very easy to explain because yoga is very soothing and calming. Uh, we talked about guilt today, but one of the major emotions that people try, if not the main one, that people try to avoid with skin picking is anxiety. And OCD is also tied into anxiety. That would be a fundamental feeling that people experience with OCD as well. So when you lower your anxiety, you will lower these symptoms as well. Um, so that would be the fastest explanation that I could come up with. That can also point you in some other directions. If yoga calms you down, try to pinpoint which component of it is. Sometimes people like the breathing exercises. Sometimes they like the kind of tying yourself into a knot physical thing. Sometimes it's the meditative aspect of it, and then you can zoom in on what actually works for you and just bring in more of that into your life. Okay, so I'm not going to mark them as as answered because then they become visible and anonymity is the key. Do you find that there is a pattern between people with skin picking and them having stronger values, aka they get more intense fight or flight response when they feel guilt? Well, what I do find this is a very complex question because at least when I'm speaking from a constructivist point of view, as I am tonight, it's very difficult to generalize on the content of anyone's values or constructs. But in terms of how these constructs are applied, I would say yes. There was one webinar where I talked about this a little more. Well, it was a webinar on perfectionism, I think, where I explained the pattern that I've noticed. It's something that we call in constructivism impermeability, which is essentially when there's only one right way to do something. And that one way is usually so narrow that it's almost impossible to walk that way. So you inevitably fail. So that's something that I've noticed. I guess you can translate that as being rigid, but that's not quite what the term means. So that's something that I've noticed. And then the other thing that I've noticed is that in general, people who struggle with BFRBs, if this doesn't apply to you, just disregard it because this is really just me generalizing, that people who struggle with BFRBs sometimes have difficulties kind of withstanding any kind of excitation in the body. So it's not just anxiety. A lot of the times people will tell me that they pick or pull their hair when they're happy, because when your body is active, when something happening, there are sensations, tremors, movements, that seems to be extremely difficult to contain for people who struggle with BFRBs. And then this leads to them avoiding anything that can lead to conflict, for example, or anything that can make them feel bad, leads to a lot of procrastination. And frankly, sometimes this can pose quite an obstacle in therapy as well, because they will avoid actually trying to do something because they're afraid of failing. And then, just the thought of failure causes your chest to flutter. And then this makes you want to go away. So sometimes people start therapy, go away, come back, go away, come back. And in a few cycles, they will decide and stay, because it's so difficult to be with that. And that's the part that I was talking about, sort of being with emotions. I will have to find a way to break it down step by step and maybe even guide you through something practically one of these days. But it's really difficult to explain other than being mindful and having equanimity. This is, I guess, what I'm trying to say is this is something that I see lacking, in people who struggle with BFRBs. I feel guilty and then beat myself up for the lack of willpower. So the big guilt is lack of willpower. Yeah, I would, if I were you, this is first, your first sentence is something that I see very often, which is, let me repeat it again. I feel guilty and then beat myself up for lack of willpower. So you feel guilty and then you kind of add even more suffering on top of that. And when you suffer even more, you will have less willpower, and then you will beat yourself up again because you don't have any. So that's the kind of cycle that guilt tends to generate, acutely and also in the long run. Yeah, so the lack of willpower is what makes you feel guilty. So the way that you can think about that is, what's the opposite of not having willpower? I guess, obviously having willpower. So then your question is, what kind of a person are you if you don't have willpower? Or what kind of a person do you have to be when you have willpower? And it's maybe useful to break it down, because when you say willpower, I assume you mean control, ability to stop when you want to stop. But you are doing something, so there is a will for something. So that's also a way that you can maybe get to know willpower a bit better. What other soothing or release instead of picking do you recommend, or is abstinence the answer? What will soothe you depends on what aspect of the whole experience is the most soothing one for you. For some people, it's touching the skin. Sometimes it's like the sound of a pimple popping, for example. Sometimes it's the visual aspect, like something coming out. So you have to pinpoint which part of it actually suits you, and then just find something that feels. Sometimes it's also the texture, like the sensory aspect of it. So that's something also that might work for you. But generically speaking, if I would have to recommend something to soothe you in that moment when you feel the urge to pick, you can find a lot of those short guided either grounding like exercises or relaxation exercises. I shared in one of the previous webinars, I shared a recording which is for people who are intensely anxious, but it's more dynamic than meditation. It requires you to do things, say things, move your arms. So that tends to help people loosen their urges. So that, in fact, so this is, I don't know how to do this now, because this is not anonymous as a question. So if I reply, your name will be public. So I'm not going to do that. But if you want the meditation, just email me and I will send it to you. I thought I could type an answer. How do you process and move past guilt when you have a constant reminder of what you feel guilty about? Well, this is why I talked about compassion and forgiveness as being very important. How intense or how permanent guilt will be depends on the way that your constructs are kind of framed. Previously, just a few minutes ago, I mentioned the term impermeable as a way in which we sometimes apply constructs. This is something that we see in perfectionism, even in OCD as well, this type of constraint. And when this happens, that means that there's only one way to do something. And when there's only one way to do something, if you screw up at any given point, that means that guilt is going to be there permanently. I mean, I'm not saying you're condemned to permanently feel guilty, but I mean that as long as the construct is arranged in such a way, that means that once you make a mistake, it's like a permanent mark. So I think this is what you mean when you say there are constant reminders. One thing that you can think of is that you can reframe the way you think of scars if you have any, if that's what you mean, or maybe just red skin or inflamed skin. I've had clients over the years, not just with skin picking. So I've had clients who struggle with all kinds of health issues that have left them with scars or some kinds of reminders. And a lot of them start seeing them as something that will push them and move them forward, as a reminder of something that they shouldn't do again. Sometimes it's a reminder of their resilience because of the ordeal that they had to overcome. So there are many ways in which you can reframe this. But it all starts with one thing, which is acceptance of what your skin is now. And then seeing what you can reasonably and healthily do to improve your skin. So that's where you always start, by just kind of accepting whatever your reality is in the moment. And then you add forgiveness on top of acceptance, and then you work on everything else, which all sounds nice and neat, but it is a process that takes a while. Um, can past webinars be accessed? Yes. They're all on our YouTube channel, so you can just type SkinPig in YouTube and you will see our channel, and all the webinars are uploaded. They're usually uploaded in two parts. One part is just the me talking, and the second part is the Q&A part, because otherwise videos can get very long. Some of them are like 3 hours long, so we had to start cutting them. How many people join these webinars? That depends. Currently, there's 128 people, but there were more in the beginning. I didn't follow it, so I don't really know exactly. There's a way, some people from SkinPick know because they check somewhere in Zoom, and I have no idea where to find that information. But yeah, it's always above 100. It was an amazing webinar. I'm from Brazil and I'm doing therapy. Thank you for your help. I want to know, how can I identify guilt and distinguish it from shame? Well, first of all, thank you for your kind words, and I'm glad that it was useful for you. And the second part, you're asking if you have no idea what an amazing and complicated theoretical question you're posing. So what's the difference between shame and guilt? At least from a constructivist point of view, it's a very subtle difference. Guilt is essentially when you deviate from how you want to see yourself. Shame is when you deviate from how you think other people perceive you. Sometimes these two can converge into the same thing, and then at other times they can be completely different. So that would be the strict definition. But my suggestion for you is that you don't have to split theoretical hairs. This is interesting, like if you're interested in relational psychology, this is a very interesting conundrum to solve. But in reality, when you're thinking about your experience, I think you can just put them both together, because when you examine the values and the behaviors and see which one needs change, regardless if it's shame or guilt, you will more or less come to the same conclusion. So I wouldn't necessarily, bog myself down with these distinctions. They both have to do with deviating from something in the top of the pyramid. What can you do as a partner to help someone facing skin picking? So the first thing you can do is actually talk to this person and then see what kind of help do they need. The reason why I'm saying this is because different people really have wildly different needs. Sometimes just the basic thing, which when your loved one struggles with picking, most people have the impulse to point that out. Some people will appreciate this very much, especially when their picking is automatic. Then it does help when you point it out. Other people will be furious at you and they will not want you to say anything. So that's just one example where you really need to sit down and talk to your partner and then see what your role can be. I suggest that you respect whatever boundary they set, even if it seems completely irrational and useless to you. Whatever it is, it's the best that they can do now. If they need anything more, they will surely ask. And even if they ask you to point out their picking, I would always be very precise and ask, what's the best way to point it out? Sometimes, people can be hurt by words, especially if it's very often. Like, you don't want anyone telling you every 5 seconds, you're picking, you're picking, you're picking. I mean, just saying that will cause them to pick more because of the anxiety they will provoke. So just try to figure out a very non-threatening, low-key way to point it out. What works is sometimes a hug or a touch or a keyword, something that sounds very benign, Or sometimes just holding hands helps because it actually is a technique to get someone to stop picking. So that's something that you can do. But most of all, I would sit with this person and listen to what they have to say. That's where it all starts. Is there a relationship with body dysmorphic disorder and skin picking? Yes. It's not the most common. So when we look at all the conditions that occur along with skin picking, the most common one would be OCD, or even more common than OCD, sorry, would be other forms of BFRBs like hair pulling or nail biting or something like this. So that would be the most common one. Then there would be OCD, and then other anxiety disorders, and then somewhere down the list also BDD. But yes, it does happen sometimes, especially when it combines with scarring. It tends to make it much more difficult to handle. So the answer is yes. Since the question is very clear, I don't know what else to add. There's nothing for me to riff off of. Is there a program like this for trichotillomania? Yes, it's called TrichStop. Are there some anti-anxiety medicines that are helpful when treating skin picking? So some doctors will prescribe antidepressants like SSRIs, and there is some, although limited, evidence that they work. In general, from the research that we have, psychotherapy is more effective than medical treatments. So that's what the studies say. But yes, you can ask your if you have a psychiatrist, then ask them. If not, get one and ask them, and they can prescribe an SSRI for you. That's probably the most effective thing they can do. Have you ever had to deal with doctors or therapists not taking you seriously? Well, I am both of those. So I take myself seriously, more or less. No, not really. I mean, in our field, because psychology and mental health in general is a field that's theoretically very fragmented. And then you have these little cults where everyone will think that they're right. So, for example, I've had people, as a constructivist, I tend to have a very eclectic approach because constructivism is very kind of agnostic on the ultimate truth of anything. And we usually want to know what works because that's what we care about, not just debating what is, essentially right or not. So in that sense, I'm not very tied to any particular approach. For example, I have colleagues who are psychologists and who will oppose medication very strongly. And then if I ever imply that something might be best treated with medication, they will basically just, dismiss my comments as being reductionist. On the other hand, a lot of my colleagues who are doctors will dismiss anything psychological, especially if it's related to any kind of psychodynamic or insight-oriented approach, Freud especially. I easily resolve that because I usually just ask them, okay, if you don't like Freud, can you just give me like a specific reference and a specific concept that you don't like so that we can talk about it? And then usually you discover they've never read him. So in that moment, whatever they say, I really don't care for. So I have disagreements with my colleagues around some things, but I don't really take that very personally because ultimately what works is what's important. And I don't have a problem admitting that I'm wrong if I don't like something. So that would be the short answer. I mean, it's just other people's opinions. Like, it's none of my business. Let me see what's next. I recently discontinued sertraline and have reduced my skin picking. Can SSRIs sometimes increase skin picking? This is very rare. For sertraline specifically, I've never seen anyone, or at least I don't remember right now that I've had any client who's experienced an increase in skin picking. I have seen clients, although, like I said, very rarely, who've experienced an increase in skin picking and hair pulling with certain newer types of antidepressants, those that act like desvenlafaxine. I can't even pronounce that word, for Pristic. That's what I've had experience with, although very mildly. So overall, I would tend towards no, especially because SSRIs also tend to reduce anxiety. They have that kind of anti-anxiety effect as well. So they should help. But if your experience is such, then just I mean, trust yourself. If you pick less after you discontinued a drug, good for you. But overall, with sertraline, I've never heard of this before. Well, until now. I take medicine for anxiety and now for OCD, and now my skin picking is worse. That depends on what medicine you're taking, but if you've noticed that your skin picking is worse, I suggest that you talk about that with whoever your prescribing physician is, because they can perhaps replace the medication that you currently have with something else. The idea is not for you to have, less OCD symptoms, but more picking, because I don't think overall that's helpful. So maybe they can see if they can either reduce or increase the dosage of something, or simply replace medications. Because especially for OCD and anxiety, there are dozens of drugs available out there. So surely you can find something that works well for you. If someone has taken the skin pick program last summer but still wants to work on their lifelong skin picking, what would you suggest? Well, if you've completed the program, that means that you should have the skills to sort of, to keep it under control. So in that case, I guess what I would suggest is that you try to deal with whatever you feel the root causes are. If you completed the program, I think you should at least have a vague idea of kind of what's behind it, and then focus on that. And if this is not your first webinar, then you can anticipate that I will suggest starting a serious mindfulness practice and getting a teacher, like a good qualified teacher. Because what we know is that long-term, meditation practice will reduce your baseline anxiety, and it will make you more, it will develop equanimity, so you won't have to react to the urge. This has been so helpful. Thank you so much. Well, thank you. Is there somewhere I can watch the recording of all the past webinars? Yes, like I said, on our YouTube channel, and you will receive a recording of this webinar as well in a day or two. What are BFRBs? Body focused repetitive behaviors. So it's an umbrella term for skin picking, hair pulling, nail biting, anything of the sorts. So any kind of bad habit that has to do with your body and that's repetitive. Lip biting also. I would also be interested in that video that you mentioned. I need more details. If it's any of the webinars, then they're on our YouTube channel. Did I recommend? Yeah, I did recommend a guided exercise, but that's an audio file. So it's basically a guided audio. Because your name is not, you didn't write your name, you wrote something. Just confirm if it's okay that I paste the link. I have this uploaded in a Dropbox file, so I can paste the link for everyone to download it if they like. Just type something and let me know if it's okay. If not, just email me. How do you suggest to discover what specific boxes are triggering picking? I think I would probably have one or two at least, but I don't know which one is triggering it. For me, it's usually just a spontaneous reaction or carries over multiple days, weeks, and so on. It's not from a particular fight or anything that is obvious to me. What would you suggest? Would you suggest mindfulness sitting with the current emotion at the time of picking? So one thing that you can do is just install our skin picking app. So it's free. You don't have to join the program to use the app. So that's something you can start, and then start logging as much as you can. I agree that sometimes, especially when these kinds of boxes are nonverbal, so when they're either very old from our childhoods, or when they're simply just a product of our experience that's not consciously created, so it's kind of a feeling, it is difficult to figure out what it is. Even in face-to-face therapy, sometimes it's very, very difficult. There is a class of constructs that we call pre-verbal constructs. Those are the very, very old ones that were created before we actually adopted language. So something from our very early childhood. And when we work with these in therapy, it's exceedingly difficult to put them into words, because sometimes for nonverbal constructs that have been created when we were adults, or at least not little kids, we usually have associations, memories. We can find something similar. We can compare it to a song, a painting, whatever. But when it comes to these pre-verbal ones, they're kind of vague, but also intense at the same time. So it takes a long time and very patient collecting of data. So the self-monitoring app would be a very good place for you to start. And then when you make entries, focus on what you feel just before picking, no matter how strange and irrelevant it might be. Okay, I got the permission, so I'm going to put the link. Just 1 second. Let me open my Dropbox and I will share the link for anyone who wants to try the exercise. If only Dropbox would all be kindly open. Sorry, I'm technologically highly challenged. Okay, and also resisting it. Okay, there you go. So I replied in writing to a comment and you have a link there, so you can download it. It's probably going to stay there, so if you want to use the link, just use the link. Okay, so this should be answered, and yeah, you can see the link there. Let me continue with the questions. Sorry for the detour. Would love that meditation link that you mentioned. Here's an anonymous comment that you can reply to if you like. I just replied to another one, but thank you. If you use Insight Timer, that was also uploaded there at some point, so you can play it there as well. It's meant, I wouldn't even call it a meditation. It's meant for people who are very anxious. So the idea is to calm you down, not to observe our thoughts and whatnot. So it's kind of more structured than a typical meditation. Is skin picking a form of OCD? So that's a highly contentious issue, and it depends on what year you're asking me in. But currently this year, we can say that it's on the spectrum, but it's still a separate entity. So it shares quite a lot of traits with OCD, but it is skin picking. It's called excoriation disorder. So it is itself. It's just on the spectrum. For someone who is new to researching this condition, I have battled since the age of around 5. Where do I start in learning how to stop? I love this session, but it also made me realize I have a lot to learn and not sure where to start. So if you want to start with something practical, all our webinars deal with one topic or another, but they're not all equally practical. So I would suggest that you start with 2 specific webinars. One is a webinar on habit reversal training, and the second one is the webinar on experiential avoidance. The reason why I'm suggesting that you start with these is because they will also give you some sort of practical, let's say a practical framework that you can incorporate on your own and actually do something to stop practically. And then whatever issue arises as you work on these practical things, just Google that. But it is very useful to have a skeleton to work with, so a kind of structure. So these 2 are what I would recommend. There are also a few books out there, although I can't say that they're revolutionary in any sense. I mean, they're not bad books. It's just that I don't know that you would get something theoretically significant from them. Thank you for this webinar and greetings from the Netherlands. Well, greetings. I love your waffles. I spent one summer in Amsterdam when I was in medical school, and I ate so many of those, I cannot even. If you make skin picking more difficult, create obstacles for yourself, for example, less mirrors, less bright lights, and so on, would it help to slowly stop? Or do you find other ways to keep doing it? What is your experience? Thank you. So creating these, as you say, obstacles is called stimulus control, which is like dimming the lights or using a timer in the bathroom, implementing all these ways in which you're not going to be triggered to pick. This for sure helps, but in my experience, you need to add more to this. In our program in SkinPick, these techniques are just one part of one session, so they don't have a huge place. There are other techniques like competing responses that you can introduce, but then I would also really work on what triggers you, what's the emotional background behind what triggers you, and then work on that. Because this will give you more control and it will minimize damage for sure, but if you're going to change, you're looking for a long-term change. It's kind of like here when I was talking about guilt, the idea is to alter the whole cycle, to change the way you relate to the emotion and to see what the emotion is telling you so you can fix it. it is a kind of solution to have a competing response every time you need to pick, but it's a much better solution if you actually understand the urge to pick. So that's something that I would advise you to kind of dive into. Is this normal? Well, that's a general question if I ever saw one. Um, I don't know how to answer it, to be perfectly honest, because I don't know what's normal. When you're a psychotherapist, after a while, normal stuff stops meaning anything because, it's an issue you're dealing with. But are you normal? I can't say, I don't know you, but most likely you are. Have you found that focus disorders like ADHD are tied to skin picking? Finding it difficult to complete these tasks? Skin picking is my time filler. Yes, yes. That's also, when I was listing co-occurring conditions, I left out ADHD, but this is also a common one. Uh, I don't know the exact mechanism because guess what? There's not a lot of research on the topic, but just working with clients, I've realized that not being able to focus on something will usually generate a lot of anxiety or restlessness. And then skin picking helps kind of channel that into something. So people will often say that skin picking actually helps them focus. So absolutely, yes. That means that, but just to be clear, it probably does not mean that if you deal with ADHD, the skin picking will go away, but it's probably going to be less intense. So first, get ADHD under control, and then slowly deal with skin picking. I'm a skin picker on my arms. I found that wearing a cool shawl, arm sleeve, sun protection found on Amazon really helps with avoiding the area. I suppose this is related to the stimulus control comment from earlier. I'll have to Google that and see how it works. I'm always on the lookout for new techniques because then, I get to recommend more things to clients. So thank you. My mother is picking her skin since she was young as well. I just did not recognize it as such when I was young, as she's not doing it in her face, but her arms are full of scars. Could it be something genetic? Could it be that I got my behavior and the way of handling my anxiety from her without knowing? So a lot of people, I've seen both skin picking and hair pulling in all the BFRBs. I hear these stories from time to time that members of the same family will kind of have that behavioral pattern, or siblings would also have the same issue. There are two possible explanations for that: either genetic, or it's something it's a learned behavior, so something you've kind of internalized as you were growing up. Currently, we don't have any solid evidence to suggest that BFRBs are genetic. In fact, there's only a handful of studies that I've seen. They're very unconvincing, and they usually just show correlation. And correlation is just not really, it doesn't speak about causes. It just says that two things might occur at the same time. So we cannot exclude genetic component to that for sure, but just because it runs in the family does not mean that it's genetic. So that's important to distinguish. Because among other things, from our parents, we learn, our parents with their behaviors and with the way they intentionally raise us, they give us coping mechanisms. So that's something that we learn. And it is something that you could have learned by seeing your mom pick sometimes. So both are possible, but I think for the purposes of therapy, just thinking about it in terms of behavioral patterns and learning coping skills is just practically more useful, because then at least you can do something to change those patterns. And if you see it as genetic, then what can you do? So I would, for the sake of being practical, I would first go with the learning hypothesis, just because it's going to give me more useful tools. You should have a podcast. This was so amazing. Well, thank you, but I have given it some thought, but I don't think anyone would be interested in hearing me ramble all the time. Once a month is perfectly enough, probably. Uh, thank you from Argentina. Well, you're welcome, Argentina. I think I used Argentinian politics as an example for something a while ago in one of the webinars. Do you have any practical tips for lip picking? Well, that depends for what. If you're looking for competing responses, that tends to be a tough one. Just start with the basics and try to use, a chewing gum or something so simple. And then if that doesn't work, you can. I think the best thing to do is you can just email me and then just give me more information, because every competing response has its limitations. So it's kind of hard to recommend something just when I know this one information. So maybe send me an email and tell me what you tried in the past, and then see if or at least where is it that you pick your lips and how. That's also important, because for whatever reason, my brain just assumed you bite them, even though that's not what you wrote. But so just please give me some more information, and I will email you back. So this seems like a good place to stop now. Oh, there's one more. Okay, let's answer one more question, and then we can end our evening. I didn't start. Every time I say let's end here, I get like 6 questions. I didn't start picking my scalp until I was in my early 30s. Most of what I've read suggests people start at a younger age. Any thoughts? Yes, most people will start at a younger age, but I guess overwhelming majority of clients will start picking around adolescence sometimes, because usually what the major trigger is acne or pimples or skin problems of some sorts. But people do start picking their skin at a later age as well. So it doesn't really change the way you approach treatment in any way. So whenever you start, you can still use all the same techniques and they should work equally well. To my knowledge, there is no research that says that you approach treatment differently if you start at a different age. I mean, at least I think because you started in your early 30s, it might actually be easier for you to figure out what triggered it and how this mechanism came about. Because when it starts when you're much younger, it's very difficult to remember, and people just have a hard time putting all that into words. Are all of the skin pick therapists also constructivists? No, I'm the only one actually. So the reason why I'm currently, of all the skin pick therapists, I'm the only constructivist. We had one more previously, but she's currently, I think, not taking any clients with us. Every therapist that works for SkinPick will have a different approach, because therapists have different approaches, but everyone will follow the same basic structure. Our program is not based on constructivism. Constructivism is the way that I look at human psychology and like the world in general. So I like to put that perspective, because I don't think it's specifically in psychology, constructivism, because it tends to be seen as something highly intellectual and very abstract, is kind of sidelined. And I think it's quite useful when you give it some time and when you know how to digest it. I think it's quite useful. So this is why I present it. I think that perspective is something that you don't get to hear in many different places. So that's why I present it. But other therapists will use different approaches. Like we have therapists, most of them will of course use CBT. We have therapists that like more psychoanalytic approaches, transactional analysis, body psychotherapy, neurolinguistic programming. We have therapists to do all kinds of stuff. But like I said, everyone that works for us will use the same program, which is a combination of habit reversal and acceptance and commitment therapy. Acceptance and commitment therapy is a newer, let's say, type of CBT, one of the third wave CBT therapists. And the reason why is because we have empirical validation that these work. So what you will get is a program that works, and then every therapist will add something more, whatever suits their temperament. And also, constructivism is technically very eclectic. It will take anything that works, including CBT techniques. Well, actually, CBT kind of arose out of a very narrow and wrong interpretation of constructivism. So they're like our younger children in some way. So the answer is no. I get into these digressions sometimes. I'm sorry, I will have to practice being on point more. Or I will end up sounding like Slavoj Žižek in a couple of years. If you don't know who he is, Google him. This is a wonderful service you're providing. I have never talked to anyone about my picking, and I've been doing it all my life. This is so very helpful and greatly appreciated. Thank you for reaching out with these webinars and providing so much helpful information. Well, thank you so much, and I'm glad that it helps, and join us next time. Oh, someone says they started peaking at 42. So I guess this is a shout out of support for our client. Next time I will make sure to activate the chat because it's been deactivated for I don't know what reason. And I know that people like to chat, and this is also a part that they enjoy. So then you can talk amongst yourselves. So this is a good place to start. And I swear I'm not answering the questions that are just arriving because this is where we're ending. I hope to see you in June. We will be talking about sort of how to present skin picking to other people. And what I will add in there as well is sort of how you can kind of define what's right for you when you communicate about skin picking for other people, regarding the question that someone asked earlier about how they can help. So thank you very much. And I will hope to see you in a month, and have a pleasant evening or afternoon.